McNeil. This feels very official.
It does, yes.
Welcome and congratulations on being named this year's Mainline Health Heart Champion. We appreciate you. We appreciate the work that you do. Can you tell us what type of cardiologist you are and what kind of patients you see?
It's really great to be here today, and I'm really honored to be the Heart Champion. So I'm a general cardiologist, meaning I take care of a variety of cardiac diseases, including congestive heart failure, valvular disease, coronary artery disease. But I have a special interest in cardio-obstetrics, which is a field of taking care of pregnant women who either have cardiac disease going into pregnancy or develop cardiac complications while they're pregnant or postpartum.
Now, I know you're all about heart health for all women, not just pregnant women. And I heard a statistic that lately there's been an uptick in cardiovascular disease in women who are 55 and younger. Why do you think that's happening?
Mainly because of lack of unawareness of some of the main risk factors for heart disease, including diabetes, smoking and vaping, obesity, high cholesterol. So I really encourage everyone, men and women, to know their numbers, talk to their doctors about checking their cholesterol and their blood pressure and their blood sugar, making sure that we identify those risks early so we can intervene and hopefully prevent heart disease down the line.
Now, I know a lot of us are thinking, what can I do right now to lower my risk? Are there any lifestyle changes that I can make, things that I can be thinking about? Sometimes it seems like it's a big hill to climb, but it's just one step at a time. So what are some small steps I can take?
Making sure that you're eating a heart-healthy diet, regular exercise, and obviously not smoking or vaping. American College of Cardiology recommends 150 minutes of aerobic exercise a week. Jogging, running, biking, dancing, swimming. I tell my patients, pick what you like to do, try to make it fun. Heart-healthy diet includes a plant-based Mediterranean diet, avoiding processed foods, fatty foods, fried foods. If you're smoking, stop right now. That's the number one thing you can do, to improve your life and reduce your cardiac risk.
So by a show of applause, can we all commit to doing at least one of those things to better our health? I think we're in.
All right.
I think we're in. Okay, so earlier you mentioned that you specialize in cardio-obstetrics. That's a term that, I'm not a doctor, but I've never heard that term before. Can you tell us a little bit more about that? Is it an emerging field, and what exactly is it that you do?
I do think cardio-obstetrics is, a fairly emerging field, very fast growing. When I graduated medical school, I didn't know it existed. And then through my training, I had, so much exposure to pregnant women or postpartum women who had cardiac complications, and I learned so much. It's a field where we're caring for pregnant women, whether they have cardiovascular disease going into pregnancy or women who develop cardiac disease during pregnancy, such as preeclampsia, which is a dangerous, life-threatening, elevated blood pressure issue.
So when you talk about developing those complications, how often does that occur? Are those statistics major? Are they minor? And kind of what should we be on the lookout for?
Cardiovascular disease is the number one reason for maternal mortality in the United States.
That's frightening.
Yes, it is. And so spreading awareness and educating people, on their heart health, on their risk factors is so important to help reduce that statistic. And when women have heart disease, we really want them to have a cardio-obstetrics team in place, which involves your OBGYN, your cardiologist, primary care doctor, whatever other specialists are needed throughout your pregnancy and beyond.
And is this a team that is in place before the pregnancy? Do they get in place during the pregnancy? And how do they work with the mom-to-be?
Ideally, it would happen pre-pregnancy when a woman is thinking about getting pregnant. It doesn't always happen like that. But
nothing ever does, right?
But really what we're doing is collaborating, monitoring the patient and baby, checking in, making sure there's no red flags during the pregnancy, to get mom and baby safely through pregnancy, delivery, and then the postpartum period.
Anything else you'd like to add? Anything that you think it's important for us to know?
I think one of the most important things is the doctor-patient relationship, and most important member is the patient. And the patient really needs to trust that we have her best interests in mind and the best interests of her baby. And I think lastly, it's important to listen to the patient and their family, throughout the whole process to make sure we're providing them with the best care we can.
Dr. McNeil, it's so comforting to know that we have doctors like you who are on our side. Congratulations again on being named Mainline Health's Heart Champion. I think we can all agree that this was an interesting and informative discussion.
Thank you.
And we appreciate you being here with us this afteroon.
Great. Thank you so much.